Hello everyone. So now we'll continue with the part 2 of this lecture that now we'll see the spatial senses stimulation technique, and that the first will be the visual system. We can use objects like pen light, bright colored blocks, photo card, etc., which helps to activate the photoreceptors with the help of cranial nerve 2 to the higher centers. Visual discrimination, conscious awareness, and recognition of objects, alerting and orientation responses are the result of this stimulation. Application through visual objects of varying colors, sizes, etc. can be used. Soft lights and cool colors are used for relaxation. Bright colors and lights are used for the stimulation. It is important for patients with hemianopsia and unilateral spatial inattention. Next will be the auditory system stimulation. In this, the verbal commands, variable sound, rattle, audio taps, etc. can be used, which activates the cochlear receptors by cranial nerve 8, vestibular cochlear nerve, to higher CNS centers. Auditory discrimination, awareness, recognition of sounds, alerting, and orienting response are the result of the stimulation techniques. Next comes the olfactory stimulation. In that, we'll use varying orders that stimulates the sense of a smell. It activates the nasal olfactory receptors to cranial nerve first, that is the olfactory nerve, to temporal and frontal lobes. Pleasant odors are example used are vanilla and favorite foods. Stimulant odors are ammonia and vinegar. Relaxation responses with pleasant odors are always have an important role when the patient is hyperactive. These techniques are also used in cases of traumatic brain injury when we have to go for multimodal comma stimulation techniques. So, the alerting, orienting, arousal response with noxious odors can be present. Gustatory stimulation techniques, in that the taste stimuli we are using, different taste stimuli we are using and placing on the tongue with the help of a tongue with the help of a thin tube which provide an localized taste to the certain areas of the tongue. It activates the taste receptors on the posterior tongue via cranial nerve 9 to anterior and sides of the tongue via cranial nerve 10 and cranial nerve 7, that is a facial nerve, to higher centers. So gustatory stimulation input will be through hypoglossal nerve, through vagus nerve, and through facial nerve. It helps for the recognition of taste. Application of stimuli by presenting varying foods. Various foods evoke emotional context also. Here, the gustatory stimulation produce emotional context because of its connection with the limbic system. Right? Multisensory treatment techniques. In this, we are using multimodal, that is varied sensory stimuli are presented in the context of meaningful activities like tactile, vestibular, proprioceptive, and visual. It activates the sensory receptors and higher brain centers. It improves sensory discrimination and improved perception. Varied stimuli are combined with the functional task. It is used for patients with a sensory integrative dysfunction. For example, when therapists talk to the patient and demonstrate the exercise for him by any means or correct his performance, these means are auditory, visual, vestibular, tactile, and proprioceptive stimulation working together. So, if I give another example, if I am giving command to the patient, meanwhile I am positioning the patient's hand passively to certain degrees, and also I am providing an pressure to the hand, then with the command I am using auditory stimulation, with the pressure I am using the touch and pressure sensation, and by giving passive movement I am also using the exteroceptive sensation. So this is the example of multisensory treatment techniques, right? So these are the spatial sense stimulation. We always use these techniques in coma stimulation techniques, because in that the patient we are using the olfactory system stimulation because it is having direct connection to the temporal and the frontal lobe. We are using gustatory stimulation technique because they are having a connection with the limbic system, and we are also utilizing the visual and vestibular or the auditory stimulation because to make the patient attentive by stimulating the patient's response, right? Because at that time the patient is unconscious, or it can be he can be semi conscious, so we are utilizing these systems as a base to make the patient aware and make the patient conscious, right? So these are also the part of the coma stimulation techniques. And the multimodal sensory stimulation techniques we are always utilize in the physiotherapy program. We always utilizing multisensory treatment techniques because it is not just a single sensory input that is responsible for the good motor response, but it is always the multisensory treatment technique which leads to spatial and temporal summation in the brain, and it will lead to good response. I hope you all understand, and these are the references you can go through. That is Susan Sullivan in chapter 10. They have given one table in that they have mentioned about the facilitatory and inhibitory techniques. You can also go through Trombley book, William Petrite book, and also in Darcy and Umfred they have mentioned it very well. And these are the further readings, and I hope you all understand, and thank you.